Hello everyone. The concept of a universal national pharmacare program in Canada has generated some important discussions this year. In September, a coalition of organizations that include the college released consensus principles that outline key concepts that should govern such a system. These principles are consistent with the recommendations the House of Commons Standing Committee on Health released in April. In this blog, I'd like to share some details from a roundtable session that Health Canada conducted with stakeholders in Toronto in late September on behalf of the Advisory Council on the Implementation of National Pharmacare. Dr. Alan Grill, a physician advisor with the CFPC's Professional Development and Practice Support Division, attended the meeting on the college's behalf. I'll summarize the session based on several key questions that were raised. Who should the National Pharmacare Program cover? The college supports a program in which every person in Canada has equal access to essential medications, no matter where they live. Right now, public coverage varies by province, and numerous surveys have indicated that an estimated 10% of Canadians cannot afford to purchase prescription drugs. We know it's not possible to cover every prescription drug. So, we need to have an evidence-based framework to evaluate which drugs should be publicly funded based on clinical benefit, patient values, and the best value for money spent. We also need to ensure the experts who make these recommendations are not influenced by political or commercial pressure. How should the program be funded? The consensus statement that the college supports calls for a publicly administered system that is integrated with the Medicare systems across Canada. It should be transparent and accountable to the public, and it must leverage a single-payer strategy to negotiate the best drug prices for Canada. Should patients shoulder some of the cost? The college hopes that a national pharmacare program will help all patients overcome financial barriers that prevent them from accessing the medications they need. At the stakeholder meeting, most participants generally supported the notion that patients should bear some of the cost based on income level. However, it was strongly emphasized that there should also be an out-of-pocket cap on how much people would have to pay. These are all important factors that bear consideration and discussion as important work to develop this program continues. The college looks forward to contributing further to this process. If you have thoughts you'd like to share on this issue, please send me a message by email or on Twitter. Until the next time, take good care.